Mm. Good afternoon, everyone. Again, this is Byron Bradford bringing in you just your local politics and entertainment and some local news. And I might get into a little sports later. But right now, I'm looking at the issue with Medicare crisis that is looming ahead of us. Washington can no, the article talks about Washington can no longer ignore the coming Medicare crisis. I'll get back to the takeaways in a sec here. But off officials Official Washington, D.C. just got another early warning. The Congressional Budget Office recently confirmed the Medicare trustees' 2020 report that the Medicare Trust Fund, the Part A account, if you're familiar with Social Security or Medicare, Medicaid, the Part A account that funds hospitalization and related services faces insolvency in 2026. You heard me correctly. That particular Part A of that faces insolvency in 2026. We're approximately 5 years away. 5 years away. One, two, three, four, five. Wow. Right around the corner. No one's talking about this. All right. Insolvency means that the Medicare wouldn't be able to fully reimburse hospitals, nursing homes, and home health agencies, which is a lot of those jobs out there for promised benefits. That's going to affect a lot of people. I know a lot of people in that particular industry. Okay, in 2026, Medicare payments would immediately be cut by 10%. Repeat that again. In 2026, Medicare payments would immediately be cut by 10%, and the payment cuts would continue each year thereafter. That is going to be brutal. It's going to be a wake up call. So we have to start preparing now, or we need to figure out how can we, you know, avoid that type of catastrophe that happen to our senior citizens that are on these particular that are using these particular services. Medicare patients will be hit hard. You cannot cut provider payments for medical services without impacting the beneficiary of those services. Again, you're going to talk about the COVID-19 pandemic briefly highlighted Medicare's vulnerability to economic setbacks within the CBO. Last September projected trust fund insolvency was even earlier in 2024, which is 3 years away right now. Statewide lockdowns shocked the economy, spiking widespread business closures and driving high unemployment. These disruptions reduced Medicare's job-based federal payroll taxes. So if there's no one working, you can't get money for taxes. That's how it works. Threatening insolvency earlier than anticipated. So when the pandemic happened, now you see why they really want to get people back in the workforce because it's like a robbing Peter to pay Paul. Or you're talking about a full-fledged Ponzi scheme. We really have here with what I'm seeing. So if people are not working, guess what? The government can't get money from you to take care of these other services. Anyway, there's nothing new here. Uh, Year in and year out, the Medicare trustees have repeatedly warned our trusted congressmen. I guarantee you, learn who your congressmen are. Find out, do they vote? Do they? Because some guys are in these offices, they don't even vote. Don't even show up. They'll vote. You can find out if they vote or don't vote, and find out. You can look at the legislation and find out. Okay, I agree with that, or I don't agree with that. I need to know more, and you can contact that individual. But anyway, back to the message at hand here. A demographic, let me go back up here. There's nothing new. Year in, year out, Medicare trustees have repeatedly warned Congress and the White House that the Medicare Trust Fund meets neither short nor long term financial standards. It's been routinely running tens of billions of dollars in annual deficits and is expected to generate red ink well into the future. I just shake my head. I just shake my head at the lack of fiscal responsibility of the people that we elect on both sides because this is a nonpartisan issue. This is not partisan. This is about the people again. This is not a partisan issue. We can't. It's not a red or blue. It's a nonpartisan issue where people are involved and people are going to be heavily impacted once um, if this should come to fruition. So we need to put people in position to we can have a conversation and try to mitigate this rising catastrophe that's getting ready to blew up in our faces. All right, a demographic imbalance is increasing the pressure. The trustees report that over the last 35 years, Medicare enrollments double and is projected to grow by 50% over the next 35 years. Meanwhile, the number of workers supporting Medicare beneficiaries is shrinking. So our workforce is shrinking. We have more people retiring, baby boomers have more people retiring. The workforce is shrinking, so we don't have near about as much income uh, coming in, but we're trying to maintain the same amount going out. So what do? You cut how much going out. That's why the 10% comes into play. We're going to continue to cut that down by 10% until we can get the even, and you really never ever get the even. It just gets services get sacrificed. Basically, what's going to happen? What's happening? In 2008, there were 4 workers per beneficiary, but in 2019, almost 11 years later, that declined to 3 workers per beneficiary. By 2030, which is 9 years away, there will be only 2.5 workers supporting each Medicare beneficiary. Those are real numbers. Again, in 2008, there were 4 workers per beneficiary, but in 2019, that declined to 3 workers per beneficiary. And by 2030, there will be 2.5 workers per beneficiary. Wow, that's scary. Anyway, what to do if Congress and the White House really wanted to eliminate Medicare trust fund deficits altogether? A big if. The trustees say that Washington could either raise the standard payroll tax from 2.9% to 3.66%. So there's less money you're taking home, you have less people in the force. So you have to figure out something immediately or reduce Medicare trust fund, excuse me, expenditures by 16%, which is lightly. They're already on the 10%. They're going to reduce it by 10% every year after that anyway. The reality of it is we're not we don't have a bunch of people with 20 family kids no more. They're all not going to work. So you have a shortage regardless. It's going to be a short. So that's just not going to, there's no easy way around it. That's a hard choice and decision to make, and someone's going to have to make it. But finally, Congress could turn on the general revenue spending spigot to cover the trust fund losses. That would drop the pretense from Medicare Part A, and continue on to this as a social insurance program paid for by the Medicare beneficiaries during the workers' lives. Excuse me. But that would pour more gasoline on Washington's raging fiscal fires, generating even higher deficits and dangerous debt, now estimated over $27 trillion. Beyond that, and curative recent pandemic spending. I guess you're gonna rob Peter to pay Paul. I'm not sure how that's gonna work. Painless solutions are non-existent. They're all gonna be painful. There's no painless solution. You hit it on the head. It's non-existent. But targeted solutions are available, and Congress could enact a temporary party premium, the equivalent of a surcharge to cover the Medicare trust fund's projected deficit, and eliminate it when the fund is rebalanced. 3 takeaways from this. I'm gonna go over three takeaways. Takeaway one: the Medicare trust fund party account that funds hospitalization and related services faces insolvency by 2026 unless we immediately implement some things at the congressional level. Any hike in federal payroll taxes to stave off the impending insolvency would be an untimely blow for small businesses, their workers, and their families. Again, 90% of business in America are small business. Let me repeat that to you again. Excuse me. 90% of business in America are small businesses. All right. Number three, the painless solutions are non-existent. It's all going to be painful, but targeted solutions are available. It's going to be painful. Somebody's going to get the short end of the stick. That's how this is how it's going to work. Somebody's going to get the short end of the stick. And I don't know what to say. It's just, what do you do? I think we as a society, we have ourselves to blame. I feel like some of it because we've just been so unengaged, and I don't like using the word politics, but just I'll say policy that benefits everyone. But some of us are just like I talked to them, some people just busy working, trying to put food on the table and just trying to get to this age. And then when they get to that age where they think they can not necessarily relax, but they can enjoy some of the fruits of their labor, they're going to start taking it away from you because we don't have enough people coming into the workforce. And I will do another video on this because I think this is why immigration is important. This is why immigration is important. There are right ways to immigrate, but that's why immigration is important because we need those. Our country cannot survive without immigration. Period. Whether you like it or not, doesn't matter. We cannot survive without immigration, and this is a big reason why. So when you make those comments, make sure you have facts and you can look at everything to back it up. And this is why immigration is important because you know we're down to if we get to 2030, what 2.5, and we started off in 2008, we were at 4 per every beneficiary. That's quick. So you look about 2040, you talking about 1.5, probably maybe one for one. Those numbers are not in our favor. So we need to get ahead of this thing real quick here, and just we need to start looking at elected officials and start holding them accountable, and find the right people to that speak on our behalf to make sure this service is available. That was implemented in 1934 after the Great Depression, 33 or 34, the Great Depression. Again, thank you for your time. I appreciate you paying attention to me. Hey, click that subscribe button, and I'll be bringing more videos later. Have a great day.